You're listening to The Social Workers on WCDB Albany.
Welcome to the Social Workers Radio Talk Show. I'm your host, Alyssa Lotmore. And today we have Natalie Turner and Mary Moller, who are LMSWs working at the Center of Excellence for Alzheimer's Disease at Albany Med. Albany Med is one of 10 centers of excellence in New York State. Both Natalie and Mary are graduates from the UAlbany School of Social Welfare Internships and Aging program. Natalie is the Northeast Division Director for the NASW New York State chapter and an experienced clinical dementia practitioner specializing in family dynamics, education, and training. Mary is an author, adjunct faculty, student in the doctoral program at the School of Social Welfare, specializing in disease education, caregiver health and wellness, and chronic illness as it relates to brain health. So welcome, Mary and Natalie.
Hi, Alyssa. Thanks so much for having us on today.
No, thank you so much. Now, one of the reasons I'm having them on today is because they are doing an upcoming workshop through the UAlbany's continuing education program titled, No Mom, You Can't Do That, working within the intersection of autonomy, risk, and family dynamics with older adults. That workshop will be held on November 2nd from 1 to 4 p.m. So let's just start off by talking about Alzheimer's disease and what is it? And sometimes there's that, I guess, myth or false perception that memory loss is just a normal part of aging, but it's not. So talk a little bit more about what is Alzheimer's disease.
Yes. So thank you so much. So Alzheimer's disease is a form of dementia. And first, I should probably differentiate those two terms as well, something else people conflate a lot. So dementia is an overarching category. It describes a group of symptoms when someone's memory, thinking skills are not functioning to the level that they should, and it's impacting their daily life. And Alzheimer's disease is one form of dementia. So it is a disease, much like anything else. So you're absolutely right. It is definitely not a normal part of aging. As people age and get older, we tend to slow down. The body slows down, the brain slows down. But when it really becomes an issue, when it's impacting somebody's daily life, their difficulties with memory, with thinking, planning, problem solving, that's when we start to look at, is it dementia? And can be even more specifically, is it Alzheimer's disease or some other form of dementia?
Now, with dementia, why is it important to get a diagnosis?
Yes, that's really critical. Especially from our perspective, we're always pushing people to get as specific a diagnosis as we can get. Like I said, Alzheimer's is just one form of dementia. There's over, hundreds of different forms of dementia. I always say I certainly don't know them all. I don't expect our patients and families to know them all either. But knowing the form of dementia, whether it's Alzheimer's disease, Lewy body dementia, vascular, frontotemporal dementia, that can inform, how we go about managing this disease long-term, what the family should expect, what progression looks like when we have to start implementing services. So for us, that's really, really critical. And those other forms of dementia, that frontotemporal, vascular, Lewy body that I mentioned, we'll talk more about that at the program. But those are what we consider to be atypical dementias, just dementias that aren't Alzheimer's, Alzheimer's being the most common form of dementia.
Now, you mentioned the training. What can clinicians or practitioners, whoever might want to attend this workshop that you're doing, what can they expect to learn a little bit about the diagnosis and how to go about treating an individual or working with an individual in the clinical sense who has one of these types of dementia?
Yes. So one of the things that we always promote in our clinic is the fact that Alzheimer's disease, the other forms of dementia, they're really family diagnoses, and that's how we look at them. And that was kind of the basis from which we started developing our presentation. So the idea of, Mom, you can't do that, just, kind of from that quote, if someone else is there, probably an adult child at that point, so the family's directly involved. So getting that diagnosis, coming to our clinic and hearing, okay, it's Alzheimer's disease, it's temporal, you're in the mild stage, the moderate stage. How can we best support that person living with that diagnosis? And what that really means is how can, the family, and families defined really broadly, how can they best support that person living with the diagnosis? How much is mom still able to do? And sometimes what we see is a lack of insight. So how much does mom think she can do versus what she can actually do? And, Mary and I are going to just discuss the kind of key question there, the $1 million question of where is that line, and what's kind of, how much is mom able to live at risk? And on the other hand, how much is her disease dictating her choices, and when and where should families step in, and what does it look like when family steps in?
Now, with the work that you both do, and I'm sure you're going to be covering this at the workshop, how do you bring family into this? Because this is something that the family support is probably needed because the individual needs more assistance. How do we best bring in family?
Yes. So our clinic is pretty specific and specialized in that right from that first visit, when somebody's coming in as a new patient, we actually require that they bring what we call an informant. So typically that ends up being a family member, a close friend. So we like to involve family members right from the get-go. And then we try as best we can to have the social worker involved in that new patient visit. We try to have a social worker at just about every new patient visit, or as many as Mary and I can logistically manage, just to make sure, the family's involved right there, but then so is the social worker, kind of meeting them right at that first appointment, maybe right when they're getting that diagnosis, so that the family's right there to be a part of that treatment plan and care plan that's developed between the doctor, social worker, patient, and family member. So they're there right from the get-go.
This is not my area of expertise, but it's something that can impact any social work practitioner with a client. We never know if a client might be diagnosed with a type of dementia, or they might be turning into that caregiver role because a loved one has now been diagnosed with dementia. So can you talk a little bit about the care plan aspect, and not only for the individual, but also how families are navigating this, caregivers are navigating this, and the changes that may arise in these care plans?
Well, so what we see in our clinic very often is that families can be the greatest source of support or the greatest source of stress. So we try to call things like they are. So in our particular presentation, we're going to talk a lot about family dynamics, and then how that plays into the caregiving role and how that plays into care planning. Because with the Alzheimer's disease and dementia, they are neurodegenerative diseases, and they're fatal neurodegenerative diseases. So it's very challenging for families when they get the diagnosis. The future it's very scary. It's uncharted territory for families. And the other part of this is that as the disease progresses, so it goes from mild, moderate to severe, person with the disease is doing less and less, and therefore the caregiver and the family, even the family of choice, is doing more and more. So care plans need to be changed throughout the entire progression of the disease. And we'll talk really a lot about that in our workshop.
So for individuals who might be wanting to register for this, is it geared more toward clinicians and social workers and the mental health professionals? Or let's say there's somebody who has a family member who has a diagnosis. Is it for individuals who might be caregivers, or is it more of that clinical sense?
So definitely, I think both of those groups you just mentioned could gain something from the workshop. So definitely the way that we're going to present working with families and some of the interventions, I think will be helpful for practitioners, right? So how would a social worker, how would somebody work with this family? But as we talk about disease progression, as we talk about, like Mary said, we tell the truth like it is. Some families are tough. And as we talk about that, if someone is a caregiver and a professional or a caregiver, they may gain some knowledge and just background and ideas from attending as well. But definitely the way that we're going to talk about family and family dynamics and interventions is going to be geared towards social workers and other behavioral health and mental health professionals.
Now, as you guys are doing this every day through your jobs, you are working with individuals and their families, and Alzheimer's is kind of the focus of the work that you do. So is there any information that you'd like to leave with our listeners about this disease, and that it's not just memory loss, that it's something that there are resources available? Is there anything you'd like to leave with our listeners?
Well, for the listeners, what's really important is to know is that, again, this is a disease that affects the entire family. And then within that, there's the caregivers. So what we say every day here in our clinic is that's very important for caregivers to take care of themselves. It's really vitally important because as the disease progresses, there's more dependency on that caregiver. And we really want to talk about in this particular presentation about the importance of the diagnosis and why it's so important for the family to be involved. And in terms of what we can leave with the listeners is that it's very important to get the diagnosis and then to take care and look at the person holistically. What can they still do? What can they not do? Or what needs to be adapted and changed? And that's what we'll cover in the presentation.
So for our listeners, the training is called No Mom, You Can't Do That, Working Within the Intersection of Autonomy, Risk, and Family Dynamics with Older Adults. The workshop will be virtual via Zoom through the UAlbany's Continuing Education program, and it will be held November 2nd, 2020 from 1 to 4 p.m. Are there any resources for those who can't attend or this is a podcast, people listen to it at a later date? Are there any resources for individuals who might want to find out more about this but can't make your workshop?
Yes, absolutely. So we partner very closely with the Alzheimer's Association. So in this area, it's the Alzheimer's Association Northeastern New York chapter. They're located right in Albany, but cover a 17-county area. So basically from Columbia Green up to the Canadian border. And then we also work very closely with Eddie Alzheimer's Services, who provide a ton of caregiver supports and programs and information and resources as well. So both of those would be very good places to contact or to look into if someone couldn't come to our presentation, but had a family member going through this or had questions. Both are great resources.
And to our listeners, again, we were joined by Natalie Turner and Mary Moller, who are LMSWs working at the Center of Excellence for Alzheimer's Disease at Albany Medical Center. If you're interested in their upcoming workshop, which again will be on November 2nd, 2020 from 1 to 4 p.m., it's called No Mom, You Can't Do That, Working Within the Intersection of Autonomy, Risk, and Family Dynamics with Older Adults. You can register for that at the School of Social Welfare's website, www.albany.edu/SSW, and click on the Continuing Education tab. Thank you so much, Mary and Natalie.
Thank you so much for having us. We're very excited to be a part of this and to be given our workshop.
You're listening to The Social Workers on WCDB Albany.